Renal calculi, or kidney stones, develop when substances that are normally dissolved in the urine, such as calcium, oxalate, and uric acid, become overly concentrated. This process, called supersaturation, causes these solids to precipitate out of the solution and begin forming crystals. When the concentration of these minerals exceeds the urine's ability to keep them dissolved, nucleation occurs, where tiny crystals start to form. These crystals can grow larger by sticking together, especially in conditions where the urine volume is low or the pH is abnormally high or low. As the crystals continue to aggregate, they can develop into larger stones that may remain in the kidney or move into the ureter. Some people are more prone to kidney stones due to a combination of non-modifiable and modifiable risk factors. Men between the ages of 30 and 50 are statistically more likely to develop kidney stones than women. This is partly due to differences in diet, hormone levels, and body composition. Additionally, a family history of kidney stones can also increase a person's risk. People with metabolic disorders such as hyperparathyroidism, gout, or renal tubular acidosis are also at high risk. These conditions alter how minerals are processed in the body, often increasing calcium or uric acid buildup in the urine, which promotes stone formation. Individuals with recurrent UTIs are more likely to develop kidney stones. The organisms found in UTIs can break down urea into ammonia, alkalinizing the urine and facilitating the formation of struvite stones. These stones can become very large and difficult to manage, often requiring surgical removal. Modifiable risk factors include dehydration, high sodium protein oxalate diet, obesity, and poor fluid intake. By educating patients on these topics and what foods to avoid and to drink more water, we can avoid kidney stones.
Signs and symptoms of kidney stones can differ between patients, but the most common ones that patients report are severe flank pain, which is pain on the side of the back, just below the rib cage and above the waist, hematuria, which is blood in the urine, dysuria, pain upon urination, increased urgency and frequency, nausea, vomiting, and fevers and chills, which is mostly associated with infections due to complications of kidney stones. There are many ways that we can diagnose a patient with kidney stones. For example, we can run a urine analysis, and possible findings would be hematuria, increased pH, calcium, and uric levels. We can run a non-contrast CT scan, and this will show the location and the size of any stones that may be present. Ultrasounds are another way to visualize the kidneys and the ureters, allowing to see for any possible blockages and the state of the surrounding tissue, so looking for any damage. Also, we can instruct the patient to strain their urine to catch the stone if possible, and they're able to pass it on their own. This way, we can run an analysis on the stone to see what it's made of. Once we know what it is made of, we can instruct the patient to make any necessary lifestyle changes. Treatment options often depend on how severe the patient's condition is, the size, and the type of stone they have. For example, for smaller stones that patients can usually pass on their own, we recommend increased fluid intakes to really flush out the kidneys. They may also take different NSAIDs for the pain they can experience upon urination, and prescribe alpha blockers like tamsulosin to facilitate the passage of the stone. For larger stones, typically above 5 millimeters, which are harder for the patient to pass on their own, there are different procedures that the patient can try. For example, going in and physically removing the stone, or using shock waves to break the bigger stone into smaller pieces. For nursing considerations, the bigger points are just managing the patient's pain effectively, whether it be pharmacologically with NSAIDs or non-pharmacologically with something as simple as a heat pad where they're experiencing pain. Also encouraging and increasing fluid intake to flush out the kidneys and increase the likelihood of them passing the stone on their own. Also suggesting the patient to strain their urine in order to catch the stone in order to run further analysis, and educating the patient on potential life changes that they can make, like limiting proteins, calcium, sodiums, and also foods that may contain oxalates, and also watching out for signs of infection like fevers, chills, and severe burning on urination.
And now it's time for NCLEX style questions. Which of the following is the most common type of kidney stone? Is it A, uric acid, B, calcium oxalate, C, struvite, or D, cystine? The answer is B, calcium oxalate. Calcium oxalate stones are most common because of both calcium and oxalate are frequently most present in the body and diet. When there's too much of either, especially in concentrated urine, they form crystals, especially under certain medical or dietary conditions. Nursing interventions for a patient with renal calculi include encouraging fluid intake, providing a high calcium diet, monitoring urine output, educating on low oxalate foods, and restricting on all protein intake. For this one, the answers are A, C, and D. Encouraging fluid intake prevents concentration of stone-forming substances. Monitoring urine output assesses kidney function and hydration status. And educating on low oxalate foods can help the patient to understand that low oxalate foods can reduce the risk of crystals in urine, which overall reduces the chances of developing kidney stones. The answers would not be B or E because high calcium diet can increase the urinary calcium and the risk of stones, and restricting protein is unnecessary and unhealthy. Finally, a patient with renal colic is ordered tamsulosin. This explains that this drug A. dissolves the stone, B. helps relax the ureter muscles, C. prevents urinary tract infections, or D. increases calcium absorption. The answer is B, because tamsulosin relaxes the smooth muscle, easing the stone passage. It wouldn't be A because tamsulosin helps pass the stone, but it does not help dissolve it. Would not be C because tamsulosin is not an antibiotic and it would not prevent UTIs. And it wouldn't be D because tamsulosin does not affect the calcium metabolism.